Hello, I'm Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And the subject of this video is diagnosing the cause of mastitis. Now you may be wondering why we need this video, because mastitis is mastitis. But we all know that mastitis is caused by bacterial infections, and on every farm there may be a different mix of what those particular bacteria are. Understanding which pathogen is causing the disease on your farm is the most important thing we can know in order to know how to properly prevent and to properly treat mastitis. Now, mastitis is a bacterial disease. It's caused by many different bacteria, and the distributions of those bacteria vary amongst farms. It's important to know what they are on your farm because different bacteria have different reservoirs on the farm. They have different routes of transmission. Some are highly contagious, and we need to find those cows infected with highly contagious pathogens so that we can ensure they don't infect other cows. Some of the pathogens are highly destructive to the udder tissue. So after the cow has mastitis, they don't come back into milk yield, and we need to know that before we make a treatment decision. And then when we're looking at clinical mastitis, we need to know what the pathogen is in order to know, does she need an antibiotic? And if she does need an antibiotic, what's the most appropriate antibiotic? So we need to identify not just that the cow has mastitis, but we need to know what's causing it. I'm just going to discuss a few of the most common methods that we use to arrive at a diagnosis of the pathogen. The first one is collecting a clean, aseptically collected milk sample and sending it off to a veterinary diagnostic lab. So that's a lab-based culturing. That is the most accurate method we have for identifying pathogens. It's probably the slowest method we have, and it's probably the most expensive. However, every farm should probably send a few samples at least off to an actual diagnostic lab, because we need some quality control even if you're doing on-farm culturing, and the on-farm methods that are used can't identify all the pathogens that can be identified in a real lab. So there's a role for sending samples to an actual diagnostic lab in virtually every farm. Second lab-based method that we have would be PCR testing. So that's not a culture-based method. That's where we extract the DNA of the bacteria from the milk sample and run a PCR test. That's the fastest way to identify some pathogens like Mycoplasma bovis and in some instances Staph aureus, and it can be pretty sensitive. But it's important to recognize that these DNA-based tests, these PCR tests, are not detecting live bacteria. They're detecting the DNA from bacteria, so it's not a very useful test if we want to figure out if we need to use an antibiotic or not, because when we're giving an antibiotic, we're giving it to destroy live bacteria. So we can't really use the PCR test in order to decide on an antibiotic treatment. The other important thing to know about PCR tests is you need to know the capabilities of that particular PCR test, because the PCR test can only detect the bacteria that are included what they call the primer mix for that. So you have to ask your laboratory what pathogens can be detected versus what cannot. And then the third type of culturing that we do to diagnose pathogens is on-farm culturing. On-farm culturing is fast, it's the least expensive, and it's the least accurate. But there's a role for on-farm culturing as well. If you're doing a selective treatment protocol on your farm, you'll want to be using an on-farm or an in-vet clinic rapid test, because it helps us understand if we've got actively dividing bacteria that may be responsive to antibiotic therapy. So there's a role for all three of these particular tests. Which test should you use? Which one's best? Well, it depends on what you're trying to do. If you're deciding whether or not to use an antibiotic to treat a clinical case of mastitis, you probably want to use on-farm culturing. If you're troubleshooting a difficult mastitis problem or an increased somatic cell count on your farm, you'll probably want to send some samples to a real diagnostic lab. And if you've got a suspicion you've got Mycoplasma bovis on your farm, you'll probably want to use a PCR test because you'll get your results the fastest. So let's just recap. Identification of the actual pathogen causing mastitis is absolutely essential for mastitis prevention and control. There's different methods, and you probably want to use a mix of them on your farm depending on the objective of determining the type of bacteria. I would encourage you to visit some of our other videos to learn more about the specifics of some of these tests.